it is a great pleasure to introduce our keynote speaker, Todd. Todd asked Dr. Devi if there was anything he could do to support the head and neck program. I don't think he realized when he said that offhand comment in clinic that day that Dr. Devi would grab me and I'd have him signed up to be our keynote speaker that day. So thank you for humoring us and sharing your expertise with us, sharing your journey with us. I think this is always the most important way to start the day, is to reflect back on your journey. So come on up, Todd. We'll turn it over to you.
Is everybody here, Moshe? Good volume. Thank you, Heather. It is sincere gratitude that Heather invited me. Yes, I may have volunteered my services, and no, I did not realize that in 2 months' time I'd actually be in front of you all speaking. But as I mentioned earlier, this isn't, I didn't have to study for a test, so I'm not saying I'm unprepared. This is the life that I live now. So grateful to Heather for the invite, Drs. Devi and Dr. Chen, who are part of the team, the surgical team here at Stanford Cancer, their staff, Lily and Monica in attendance, Jennifer Chisner, and I've had the pleasure of meeting almost all the speech pathology team. Dr. Chen, I don't know if she's here, but Hope is one of her nurses who was instrumental, and I'll have a story about her anecdotally later in my talk. So thank you, everybody. And I'd be remiss to forget my doctor, who's been my rock, my ENT in Reno, Dr. David Mathis. He started this whole journey for me, and has just been instrumental in being the connective tissue, as it were, for this whole process. He introduced me to Stanford. He referred me to Stanford. He's been an amazing person in my life. So sincere thanks. And I spoke to him yesterday, and he's in good spirits and happy. He might even be in attendance online. So Dr. Mathis, thank you so much. So my story, when I'm talking up here today, it is my path. Everyone's path is different. We're all in this room for a reason. It's pretty similar. And it's unfortunate, but we're here together, and the fellowship is strong in this community. I didn't realize it'd be such. So when I'm talking, it's about my experience. I hope that yours may be different in a better, positive way. And in some cases, it may be worse. I chose after initial diagnosis to not dive down too many rabbit holes, to read what other people's experiences were. For whatever reason, I just chose not to think that and expect anything. It was just coming in, trust the doctors, trust the process, and just follow their lead, because they're the experts. I'm just the patient. I'm the one that has to live with it on great advice. So whatever I say, I hope I don't offend anybody, but it's just my experience. And if I appear maybe too dramatic, it really is speaking from the heart. So there's some times that I may get a little bit dramatic. So brief. We kind of all know why we're here. Head and neck titer, stage 4 squamous cell carcinoma, floor mouth. Had some pain in my neck, shooting pains through my lymph node area to my ear, July 2022. Thought I was screaming too loud at a punk rock concert that my brother and I went to. So it didn't go away after a couple of days. I had some amoxicillin from a past infection. I tried that for 7 days, 2 doses a day, thinking it's an infection, it'll go away. Whether or not the prescription was expired is irrelevant. I tried it. Nothing was working. So then I was on daily Advil, 3 or 4 a day. It got worse beginning about August. Tried to get into my ENT, Dr. Mathis. He couldn't get me in until September. So I was upping the doses of Advil. Saw him September 13th. He gave me the look after he looked, a quick, brief visual exam. And he says, well, and I says, it's cancer. And he says, I think it is. And I said, okay, what did we do? He said, biopsy next week. September 19th, he confirmed after the biopsy, while I was still in recovery, yes, it was cancer. I went to plate. Pathologist said, yes, cancer. I said, what do we do now? And he said, well, let me see what I can do. I think we're going to have to refer you to Stanford because there's nobody in Reno that can do it. By the way, I'm from Reno, Nevada. I lived in the Bay Area for 5 years. That's irrelevant, but I'm from Reno, so anything that I say, I'm coming back and forth. It's driving the 260 miles, including today, which I drove Thursday, so the storm, blah, blah, blah. Save myself from that anguish. So the biopsy the 19th. Introduced to Dr. Devi, made the trip down October 6th. Met him and his team, him and Noel specifically, his fellow at the time. Great. It was a great meeting, but still, I was petrified without question. I didn't know what I was getting into. I was on this massive campus, this massive prestigious university, and they're treating me like an actual human being, which I was absolutely amazed by, and couldn't be more grateful for that experience. It makes me feel comfort and at ease that first day. So I said, well, the next steps, and he said, well, surgery's going to have to happen. I did a call the next day. Dr. Devi would like to do surgery on October, I think it was 18th. It was less than 2 weeks on a Tuesday. At that time, I thought, wow, this is moving far too fast for me. I'm going to have to plan the next 6 months of my life in literally 2 weeks, because I did read a little bit about what happens with this process. And I just wasn't equipped to do that. Mentally, I was not in the space. I asked a question, can we push it back? And they said, well, we can. And I said, well, if cancer is going to kill me, then let's do it on the 18th. But if it's not going to kill me, then let's go ahead and push it back, because I need a little bit extra time just for my mental preparedness. So they set the date of November 9th. My mom and dad drove down. We jumped down on Sunday, the 6th of November. They stayed the entire process. I can't forget them in my gratitude list, but they stayed with me the entire time. So the 6th of November, we jumped down. Monday, it was a whirlwind of appointments, 7 appointments in one day. The 8th, got the PEG tube installed. The 9th was 10, 12 hours or whatever when they did the process. The procedures I had was radical tonsillectomy, partial walsectomy, radical neck dissection, tracheostomy, had 6 teeth extracted, and yeah, that's about right. So if anyone knows that drill, it's not pleasant, but that recovery from the surgery wasn't as bad as I thought. And the show and tell is going to be after if you are. I'm not going to get into the details. I have a feeling a lot of you know what that procedure is all about. And if not, you've at least heard of it. You know it. You've possibly lived it. I know I spoke with Chuck. We both share dissection stars and stories. So I won't go into what the procedure is all about. I actually had a talk this week, HPV, for cancer prevention for dental professionals. So I went into more of the details, but you guys know why we're here. We have a shared story, shared journey. So that's roughly the timeline of what happened. Inpatient was interesting. I had the pleasure of spending 9 nights at Hotel 300 Pasteur, for better or worse, but I had an amazing care team there. The nurses couldn't have been better. And one there's someone to really give accolades to. She really set me on a journey that I didn't know that I was going to be able to conquer. So the day I wake up, so we're on the 10th now. Nurse Audrey, Ursu is her last name up. She doesn't mind me saying. She came in at 8 o'clock in the morning. I didn't know where I was. I had a tube in my throat. I couldn't talk. I was still on meds. The surgery just happened. I've been in my room for 12 hours. I had a roommate that I didn't even know. I couldn't see my parents because they were still kind of on the medical COVID lockdown. There's certain visiting hours. Hadn't seen anybody. And Audrey comes in and says, oh, hey, nice to meet you. I'm Audrey. She starts writing things on her board. And I'm typing text to speech in a British accent because I thought it was funny. But she said, we're going to do this, 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 and this. You're going to get up. We're going to stretch. We're going to do this. And I couldn't talk. So I'm saying, how is that possible? She says, doesn't matter. We're doing this. And she instilled the belief in me that first day. I can't be more thankful for her because I didn't know what I was doing. But she made me, put me and made me stick to task. And task was, this is not beating you. You're getting on with your life. We're getting on with your day. It's my job to get you off your arse and get you up and get you back to getting better. Because without, maybe I'm not giving her more credit she deserves. She probably deserves more credit. Because I was not in the state to think that I should do anything. would have been content just lying there helpless. So she put me on that path of, okay, I can do this. And day by day, I got better and better. And then after day 6, I remember I still had the tube in, but they pulled the cannula out and pressed on my throat where the trach hole was, and I heard a screech out of my mouth, and I started crying. And it was right at the time that Samuel Cohen and his students were making their rounds at 6 o'clock in the morning. So I started crying. 2 of the students started crying. It was just a big tear fest. And I was, oh my God. But I couldn't believe it. It was just the tiniest little squeeze. It was progress. I was making actual progress. It was just a matter of time before I could actually start talking again. Because when you have that tube in your throat, first of all, it's uncomfortable, as some of you probably know. But I might not have this the rest of my life. Am I ever going to have anything go through my mouth anymore? The answer was yes. So that was some inpatient story. I was discharged the 17th of November with the Jackson Pratt still stuck to my neck, and went to the pharmacy. People gave me weird looks. We stayed at the pharmacy on University before we went back to Reno on the 17th. Those tubes came out on the 23rd, the day before Thanksgiving. Had Thanksgiving with the family. I was consuming Jevity, which was awesome, while they're eating their fantastic turkey feast. I did a story about my niece. She saw me, I had a beard because I couldn't shave because of the dissection. She tried when she saw me. She hadn't seen me since I got back. But I didn't have the tubes at least, but she tried. And she ran to her room, and she came out a little bit later. And I'm like, "You okay?" She said, "But you just look funny. You look different. You had a beard. I'm like, "It's just a beard. I can't shave right now." And I'm like, "Do you like it?" So I don't know. So sometime at the end of the night, she'd gone away again, and she came back. She gave me a big hug. She says, "Oh, Todd, keep your beard." And I said, "Why do you like the beard?" She said, "You look like Ryan Reynolds." And I said, "You're crazy." But anyway, so everyone got used to it. So after Thanksgiving, the next week, I met my radiation oncologist, came back to Stanford, finally got to OT on December 1st to be able to eat small, soft food and start drinking through my mouth, which I hadn't been able to do since the 8th of November, essentially. Then the fun began. I said the recovery from the surgery wasn't as bad as I anticipated. Not that it was easy, because I did have a splint on my arm, but once that came off, I was able to start doing normal workouts. Radiation started, 30 rounds of radiation started on December 19th, and chemo followed, so I was doing concurrent treatment. That started the day after Christmas, on the 26th of December. Those ran through January 31st. First couple of weeks, as many of you probably have experienced, or maybe not, maybe that's a generalization I shouldn't do, but first couple of weeks, yeah, I got this. Which is a phrase that I don't like that phrase, but I'll say it because I thought I would be able to get through radiation, not a problem, even though I was told all the horror stories. From January 16th through the end of March, I did not eat a single bit of food through my mouth. Barely drank any water. I was reliant solely on the G-tube. I developed oral thrush. The sores were prevalent in my mouth. My tongue was bright white. The burns on my neck, it looked like somebody was tightening a rope around my neck every night. I used the Aquaphor. That helped me a bit, and I ruined a lot of shirts because of it. But just the blistering that was going on because of the localization of the radiation, as many of you probably know, it was right there, and there's no escape from it. It's hitting your mouth, it's hitting your throat, and it was absolutely miserable. To the point where, at the end of January, radiation is the great reducer, in my opinion. It reduces my quality of life. It just has a way of making you miserable, more miserable than I've ever been in my life. To the point where I literally thought about giving up. And I noticed in my medical oncologist, my chemo doctor's report on the 31st of January, she said as much. He is absolutely miserable. He's questioning life right now, which was absolutely true. And I'll mention Dr. Thomas because she was another doctor on my team that showed absolute empathy, and she would just allow me to talk. And whether she wanted to or not, she listened. And I told her some dark things, and that was at the cusp of radiation. As many know, radiation happens, it starts getting worse, worse, and worse, and then it stopped because radiation, the treatment stopped, but the side effects continued to get worse for about another 3 or 4 weeks before they finally start recovering. So all of February, there were some dark days. Did I make the right decision? Should I have lived with cancer? The answer is obviously no, because it was already metastasizing in my throat, so where would it end up? I don't know. But it was grim to the point that, I'd had some emotional challenges and depression in the past, and I turned the corner in my life in 2021. So I was well equipped I believe, to handle cancer. I didn't know that I could handle radiation. That's a whole different mantra. I was of the belief, my mental, physical, emotional, and spiritual are all intact. Radiation tried to break me, and I wouldn't let it. There were many nights where I just felt isolated, alone. I couldn't describe what I was feeling. People, when I said I got this, people would say, "Oh, you got this. You got to stay positive." All those things, but they were very thoughts and prayers. All those things are very nice sentiments. And all I really wanted was somebody to listen to me. And that was what I did not find. let me go back to Dr. Chen's nurse, Hope. She had leukemia lymphoma. She had it twice, and she had 2 different surgeries. And there, I sent a message to Dr. Chen wondering if my tone swells ever go down. But I also mentioned that I was extremely miserable. Hope called me on a Friday night and talked to me off hours for an hour and a half. She didn't talk to me. She just let me talk. And it was one of the sweetest things. So unexpected. And just goes to tell you this Stanford Cancer Center, the team's all about. Whether it's Dr. Devy's team, Dr. Chen's team, the speech pathology team, everyone has demonstrated such a genuine interest in me as a human, and for me to get better. And for that, I cannot express how grateful I am for the team that I have, and how lucky I am to have the team that I do. So radiation, it did not break me. It jumped me to the point that my PET scan, the follow-up PET scan, in early March, I forgot the best part of the story. I am living cancer-free right now. So it was in March. Thank you. In March of 23, I didn't know what that PET scan was going to bring. All I know is what I felt all through February, that if I had to go through another round of chemo and radiation, I don't even know which one's the worst on these because it was concurrent. But if I had to go through another round, I don't know that I would have had the will or the belief or the faith or the spirit to do it. By the grace of God, it came back negative. I was clear. I was happy. My life should finally get back on track. That was like the ultimate hurdle to get that clear PET scan. Now, I don't use the term survivor because I don't like to tempt fate personally. I asked Dr. Devy if I should use what term I should use in my subsequent appointments after the clear PET scan. Did I survive it? He says, well, I have anxiety for my patients for at least 2 to 3 years. So if he has anxiety, I'm not going to tempt fate. I don't want to disappoint him. I know that's kind of silly, honestly, and a little bit facetious. But if he has anxiety, which I hope he doesn't, but I still have that concern, so I don't want to tempt fate. I asked my radiation oncologist the same thing, if I'm a survivor. He says, well, you're not dead. It's like, your words, not mine, but okay, yeah, it's true. I still choose not to use that term survivor until I get to that, that 3 to 5 year, whatever the mortality rate is, where I feel comfortable saying something like that. But for the time being, I'm living cancer free currently, and I couldn't have done it without the help of a lot of people in this room, especially the back table over there. Heather, thank you, Jim, for letting me share my story. But it's a collective fight. This head and neck cancer community it seems really small. We're touched by somebody who's living with everybody's worst nightmare. And when you think of it that way, what we have is each other and this fellowship, for lack of a better term. It really is. When I come to Stanford now, at first I was scared. Now it's a piece of cake. Now I'm coming to see what I believe to be friends, people who literally care about me in this community. And it's amazing to me. I didn't realize I'd have the support that I did. When, if I need to talk to somebody, I know somebody will listen. Somebody will answer an easy message. People are so responsive. And that's all, as a patient, I couldn't ask for anything more. Because there was a time where, people don't, it felt like I was getting excommunicated from my tribe when I told people I had cancer. They were there for the first part of the fight, and then everyone dwindled off. It was like a weird social experiment and nobody really got to the depths of what I was trying to feel. And it's not their fault, because I didn't know how to express myself. I was frustrated. I was angry. I was probably a bigger part of the problem than anything else. Thankfully, they stuck with me. The people that I care about and love have stuck with me. My care team has been fantastic. I'm able to, I still have the same issues everyone had. A lot of people in this room have tough swallowing, dry mouth. Sometimes a little bit unintelligible when I talk too fast, as you can tell when I have half a tongue in my mouth. Food does not have the same appeal as it used to. I eat slowly. I have insecurities at tables. Are people waiting for me? The tab comes before I'm even finished with my dinner, but that's kind of the pace I have to go. The body dysmorphia that happened. I started at 170 pounds. I dropped to 127. I'm back up to 160. All these transformations have happened in the last 15 months. My life is different, but I believe it's the life that I've been meant to live. I had mentioned some issues that I had in the past, and I was turning the corner on a better life. And this has almost exacerbated the point where my purpose in life has been, I believe, is to be maximum service to that which I believe and the people around me. And now that I'm part of this fellowship and community of cancer patients, survivors, caregivers, doctors, physicians, however I can be of service. If it's anybody in this room, find me. I'm not that hard to find. Ask any one of these providers. I'll give you my information. You just need somebody to listen, anybody to talk to. I've been through it. I'll just open an ear up and you just go and just flow like you're allowing me to do today. Just be open, be honest, and communicate, because there are times where I just was so frustrated when all I would do is go to work, go home, have levity, turn on the TV, and just sleep. And that was 6 weeks of my life. And it was hard. I didn't have anybody to talk to. People maybe wanted to talk to me, but I didn't know what to say. I couldn't explain it because the only thing on my mind was the pain and the misery I was suffering. So if there's any way I can be of service to anybody in this room, whether it volunteer to help out, to do anything, stretch your back, listen, walk your dog, I don't care. That's my purpose in life, is to help others either understand or help get through some of the challenges they face, because everybody in this room, everybody you meet is fighting a battle that you know nothing about. If we can just help each other, whether it's in this room or in life in general, I think we'll all be in a better place. So if I can be of service anyway, please let me know. Thanks for allowing me to share. It's been an honor up here. I think I think I've run my course. I'll be here all day, not that anyone cares, but happy to help provide information. But again, thank you so much for letting me share my story. I do appreciate it. Have a wonderful day.